Good evening and a warm welcome to everyone. I'm Preeta Harikrishnan, your host and moderator for the session and Deputy Manager of Admissions at Amrita Institute of Medical Sciences. Thank you all for being here. If you have any questions, feel free to raise your hand or type them in the chat box and we will address them towards the end of the session. Today evening, we have with us two dynamic speakers who are eager to share their significance and potential of the programs in emergency medical technology and intensive care technology. I extend a heartfelt welcome to Ms. Vishnu Priya, faculty member in the Department of Emergency Medicine, and Dr. Bharat Prasad, also currently serving as Associate Professor in Emergency Medicine. So before we start, let me ask Dr. Bharat Prasad to address the attendees today. Welcome, sir.
Thanks a lot, ma'am. Thank you for the kind introduction. Good evening, everyone. I'm Dr. Bharat. I'm currently serving as the Associate Professor in the Department of Emergency Medicine at Amrita Institute of Medical Science. So, talking about our department, we have a 70-bedded emergency department. We have a well-functioning pre-hospital care system, adequately staffed pre-hospital care transport system is there. We have level A to level D ambulances are available in our transport system. And per day, we have around 90 to 100 patients coming out, visiting our ER. So why I told this is to let you know that the amount of patients that you can see and learn from are quite very good in our institute as such. Now, coming to the courses that we provide, or today's discussion, that is the emergency medicine technology and intensive care technology. The emergency EMD course that we have been running has been started in 2013 batch, 13 onwards. So we have already done around 12 to 13 batches. We have done the course. We are well versed in it. We have a proper curriculum in it. And we have a very strong alumni network supporting the system. There are very clear guidelines regarding ICT and EMD. ICT courses has been on for last 3 years. This will be our fourth course, fourth batch of students that will be joining us. ICT last 3 batches has been passed down and has been now various, is working in various hospitals as such. The ICT and EMT has a proper curriculum. Each courses is divided into 4 years. The first year will be your primary basic learning mechanisms in which you will be taught how to know about the human body, what are the basic things you need to know about the human body. And then second and third years, you will be exposed to patients. You will have hands-on experience with patients. You will know what to look for. There will be people to teach you to identify conditions and to show you how to manage patients. And fourth year will be a internship for you in which you will be responsible with the patients that you take care. Our EMTs will have pre-hospital exposure by going for transporting patients from other hospital to our hospital or from their homes to our hospital. So we will have adequate exposure in shifting patients. You will know to shift patients inside the hospital as well as from outside the hospital. We have a state-of-the-art level D ambulance is there, which is ACLS ambulance, ICU, critical care ambulances. We routinely shift adult patients and we have a good pediatric transport system also. So at the end of your course, the EMTs will have all around exposure in shifting patients of pediatric as well as adult care from different conditions from different parts. So that exposure will be very significant from our institute as well. Similarly, we have a well-fledged 8-bedded ICU and another 10-bedded HDU. So a total of 18-bedded ICU system is there inside the emergency department. which will be open to the intensive care technology students. They will have first degree exposure to how a ICU is functioning, what are the important things to take care in ICU, how the patients will be in ICU, and what are the important metrics to be taken care of. From second year onwards, the ICT students will be posted in ICU. They can see and learn and get hands-on exposure into critical care patients. And by third year, they will be given patients to be taken care under supervision. And their 1 year internship, at the end of 1 year internship, they will know to take care critical care patients. They will know to do procedures in critical care patients like intubation, central line, arterial lines for taking care of the patient. Similarly, they will have exposure in shifting patients in ICU patients to other centers. They will know to take care of patients in different severity scales. So the exposure part of our curriculum is not at all to be not at all inferior to anyone as such. We are one of the best exposure for. We have a good faculty system. Today with me, Vishnupriya is there. Vishnupriya is a PhD scholar in our department. She is taking one of the senior faculties for EMTs and ICTs. So there are, along with me, Dr. Naveen is there, who's the head of our department. He is also an associate professor. Dr. Manna is there. She is assistant professor. And we have residents working under us, who is also a part of our system and will be in the teaching pool. So there is faculty wise as well as exposure wise, you wouldn't be have anything to worry about as such. The system has been in place for quite some time. The what and all we can do and what and all you can expect from our system will be taken in detail by Vishnupriya. She has a entire presentation ready for you people. Any questions you have regarding the courses can be met and she will answer those questions also. Okay. Since EMD courses have been running for around 12 to 13 years, our alumni students have been working with other hospitals and some has been migrated abroad and is working there as well. So those things Vishnupriya will be telling you. The last 3 ICT batches that has passed out has gone on to work in different hospitals and also some has gone for higher educations like getting MScs and PhDs as such. So taking the B.Sc EMD course or B.Sc ICT course will have a significant exposure not only to patient care, will open new areas in healthcare in which you can continue your studies and explore for further opportunities in which you can grow. So I hope that you will have a wonderful session. Vishnupriya will explain how we conduct the course and what and all we are aiming to teach and what are the opportunities you will have once you have done the course. And she will also tell you about our alumni network, who and all is working and where and all they are reached. So I hope that everyone will like the current session and will have a wonderful time. Thank you.
Thank you, Doctor, for being so crisp and giving us some of the basics of ICT and EMT, and for giving your precious time. I know you are very busy, and having taken a fellowship in accident and emergency care, you have surely done what you should do basically. And so now I think we could move on to Ms. Vishnu Priya, madam, who is currently a PhD scholar at Amrita Institute of Medical Sciences, Kochi, and she holds an MSc in Emergency Medicine, along with a B.Sc in Anesthesia Technology from SVIMS Tirupati. She teaches B.Sc students and provides clinical training to MBBS students too. As an AHA certified instructor, she conducts ACLS and BLS training for postgraduate students. Her research revolves around in-hospital cardiac arrest, CPR quality, and the use of advanced monitoring tools. Her areas of expertise include ACLS, BLS, emergency and critical care medicine, disaster management, resuscitation, science, and simulation-based medical education. So now let's hear to what Madam has to share with us. Welcome, Madam, to this webinar. We all hope to hear in detail about ICT and EMT from you. Welcome.
Thank you for the introduction, ma'am, and thank you, Bharat sir, for giving of a brief introduction and a structured thing. So now I'll be going in detail about the each course, and I'll be sharing a PPT through this so that we can be like knowing about what all the things we are supposed to go through and what all the things in detail we can see. So before going to thing, I'll like very happy to tell about this course related to the emergency medical technology and intensive care technology on behalf of Department of Emergency Medicine, Kochi. So regarding of this emergency medical technology and intensive care technology, there is like a most vast things you are supposed to be known, and yes, you are like caring for the people who are like in need and like very emergency. So now today's our agenda is to be like what is a emergency medical technology and what is like a intensive care technology and what is the view of that, like what is the curriculum basis thing for the two of the courses, and how is the alumni experiencing and where they were like currently working, and what all the things they were like experiencing related to that thing, and their career opportunities in EMTs and ICTs, and what are the higher studies you can go for after finishing of your undergraduation program related to the EMTs and ICTs, and the benefits of the higher education, and in question and answer session. So now why you are supposed to choose Amrita is like a things where the, so this is like a number one in India. Amrita ranked number one in India and top 60 in the world. And there is like a National Assessment Accreditation Council 2021. We got A pluses grade. And regarding a world university ranking, it is around 801,000 world university ranking. And NRIF ranking also it's like a seventh NRIF ranking. And we also have that our Chancellor Amma, who is Sri Mata Amritananda Mai, she was like dedicated her life towards us as like has dedicated of her life for messaging of the peace and tolerance, and she is like accessible and helping more than of 40 million people. So we all very thankful to her to giving each and every role to us to serve to the people who is like in need, and we are like continuing on behalf of her, and thanks to Amrita Vishwa Vidya Peeta. Next, coming to the Department of Emergency Medical and Critical Care Medicine from, so we have a faculty profile. So our Dr. Girish Kumar KP sir, who is like a principal and a clinical professor in Amrita School of Medicine, on Dr. Naveen Mohan sir, who is like a clinical associate professor, and he is the head of the department, and Dr. Bharat Prasad sir, who has given just now a brief introduction about the EMT program. He is like a EMT program coordinator and a consultant. And Dr. Sabarish B sir, he is like a consultant ICT program coordinator under the Department of Emergency Medicine. So these two people will be taking care of, one will be taking care of this EMT students, and the one will be taking care of an ICT students. And these are our including me, we are like a three students where they're regarding doing a pursuing of a PhD scholar program. So two of us like Vishnu Priya, me and Rishikesh, we are like doing our full-time PhD. And D. Sai Jashwant, he is like doing a part-time PhD, and currently he is like working as like an assistant professor in Hyderabad. So now this is our triaging area. So this is like entry of the casualty, and this is like a triaging area where we are supposed to prioritize the patient as who are like needed very in a crucial thing, who needs an immediate care. We are supposed to be categorize the patients, and you will be like shifting the patient to this area. And we also have the two ICUs. One we used to call like a P1, ER ICU P1, and the other one, this is like a ER P2. Usually the people who is like very critical and followed by an emergency treatment, we will be shifting the patients to P1. And who has got settled from P1, they have got treated. Now they were like, okay, then we will be shifting the patients to a ER P2 area. And this is like a adult and pediatric ward. So the people who are like well settled now, they were got a efficient and effective treatment. They were like getting settled down. They were like very stable now. So those patients will be shifting the patient to ER adult ward. And the other side we have a ER pediatric ward where we are used to take off pediatric babies who will be taking care of. The pediatricians will be directly coming to that area and treating them as soon as possible. Next, this is our class and demonstration area, which is like very important thing. Why? Because once after you people coming after finishing of your first year, we are like directly we are taking classes over here in this spacious room. So we have two classrooms. One is like a we'll be taking care of a demonstration thing and practical things, and the other one will be taking care of a theoretical classroom. So it is like very spacious and well designed, and equipment everything will be there, and we will be teaching in hands the theoretical thing and a clinical practicing. So before you are going for a clinical practicing thing, we will be giving of a demonstration towards the simulation, so that you will be like well enough confident to take over the hands over the patients and do the needful to the patients. And these are the ambulances. So after finishing of the third year, you are like well enough trained so that you can go to the ambulance and you can shift the patients and do the needful thing. And coming to the allied health sciences, so in our ER emergency department, we are pursuing these things. One is like a MSc emergency medical technology. So the qualification need to be like the qualifying pass in a B.Sc emergency medical technology or B.Sc respiratory therapy, B.Sc physician assistants, and B.Sc anesthesia technology. 3+ years plus 1 year's internship, regular course only, and the duration of this MSc EMT will be around 2 years, and the number of seats will be 5 per year as it per Amrita Vishwavidyapeetham University. While coming to the B.Sc Emergency Medical Technology, so the pass in +2 with 60% aggregate marks in physics, chemistry, biology, and English, and the duration of the course is like 3+ years, 1 year internship will be there. So recently during this 2023 inspection, the number of seats in 2022, it's like 20 seats. Now after the inspection of the 2023, it increased to a 25 seats. And coming to a B.Sc intensive care technology, the passing +2 with 60+ aggregate marks in physics, chemistry, biology, and English as usual in case of B.Sc EMT. And the course duration also will be like same, 3 years plus 1 year internship. So in this is also last for 2022, we have a number of seats for B.Sc ICT is like 10. But recently due to the last 2023 of the inspection year, we have increased the 10 seats to 15 seats as per Amrita Vishwavidyapeetham University. And these are the alumni students, as Bhatt sir has mentioned. So our B.Sc Emergency Medical Technology starts from 2010. So these are like our alumni. So from 2012 to 2016, there were like 7 people. 2013 to 2017, 7. It's like going on increasing, and now it is like around 2022 to 24. It's like total 14 students were there. And coming to ICT, it's around 9 students were there. So they were like working in various places around across the globe. So in India, 24 currently they were like working, and most of the people like working in Abu Dhabi, and currently the data is like mostly in UAE, UK, Kuwait, all those things. And currently some of the people were going in a teaching session also, as the paramedical board is like going to form. We'll be having of more chances and more scope in teaching, and we can go to the teaching sites after finishing of our bachelor's, and if we can go and pursue for a master's, we'll be like well dued in the teaching side also. And the current strength of the B.Sc Emergency Medical Technology is in 2021 batch, it is like 13 people. 2022, it's like 20. And 2023, it's like 17 people. And 2024 batch, it is like around 15 people. And B.Sc Intensive Care Technology, 2021, it's 9 people. 2022, it's 9. 2023 batch, it's 20 people. And 2024, it's like 4 people. And MSc Emergency Medical Technology, current batch, 2024 batch, we have 3 students who is doing a master's in emergency medical technology. Now coming to the introduction to the emergency medicine. So this concept of emergency medicine is like relatively new to the Indian medical world, where it become as like backbone of healthcare system in most developed countries. So this is like a field of practice based on the knowledge and skills required for like a preventing and diagnosing and management of this acute and very urgent aspects of illness and injury affecting a patients of all age groups. So if a patient who is like in a very urgent and emergency case, this our emergency medicine department stood first in the line to treat this patient and to diagnose these patients and manage as soon as possible according to the underlying disorder. So it is like a specialty in which the time is like very critical. If you are like treating the patient in the correct time, there will be of minimizing their complications. And the emergency medical team care of the patients presenting with acute emergencies. So all this initial resuscitation will be done by the emergency medical team comprising of the emergency physician, technician and other paramedical staff. So this course offers mainly towards the initial resuscitation of the patient who arrive in the emergency room. As the number of trauma and natural disasters are increasing day by day, our emergency medicine has become the need of the hour. So it's like very important, as you people will be coming to a department, you people will be studing front of the line and you will be like treating the patients. So is it clear up to now? Next, what is like a EMT role?
Yes.
So what is an EMT role? So usually you should know that what are the things you are like going to do, what is your main work. So this emergency medical technology plays a critical role in the healthcare system by providing us immediate medical care to the individuals in the emergency situations. And the EMT professionals are the who are the first responders who will be assessing the scene, assessing the patients, and we are like making the patients just stabilize for the time being and transports the patient to a healthcare facilities. So, for example, you have seen any cardiac arrest or a road trauma accident outside, you will be the first person to assess the scene and do the needful thing for the time being. And later, you are the people will be shifting the patient to an appropriate hospital, and you will be making that minimize the mortality rate and increasing the survival rate of the patient as you have treated the life-threatening conditions in the correct time. Today we will be dive into the exciting world of EMT careers and explore the various opportunities available in this field, as well as we will be discussing the importance of the higher education in advancing in your career. So overview of the EMT curriculum, the main objective of this program is to identify an emergency and to know how to manage a cardiac arrest and a polytrauma victim. Polytrauma is nothing but a multiple trauma who met for a road trauma or a motor vehicle crash victim, and transportation of the critically ill patient. Why? Because in critically ill patient, you should have been present over that scene because you are the most important person who will be like helping or guiding the patients and giving a correct support to make them feel well. And basics regarding the airway and circulatory management, and to make students self-sufficient in immediate management of a critically ill and hands-on training in an emergency procedures. So the course structures is like a 4 years program. In this, the first years you will be having all the like subjects, practical subjects related to anatomy, physiology, biochemistry, microbiology. Along with that, an introduction to computer applications, quality assurance and accreditation, English and soft skills. Why? Because this will be helping you to give additional support to maintaining of the thesis will be there. For that, it will be helps you to sort out all the things, and the computer knowledge is like very important nowadays, and the communication skills also. And the second year, the theory class and postings in the clinicals area, along with the pharmacology, pathology, emergency medicine. These things will be going in the second year. While coming to the third year, the theory class and postings in the clinical area, emergency medicine and intensive care units, and an emergency medical transport that will be going through ambulancing services. You will be part of this ambulance services and you will be like shifting the patients. And the fourth year, it's like complete, it's like an internship in the clinical area where you will be like directly communicating with the patients, and you itself will be treating the patient, assessing the patient, and you will be helping to roll out the managing the whole hospital period of that patient. And the career opportunities here, first you will be like a emergency medical technician. You will be like role will be like providing the immediate care and transport for the emergency medical emergencies and settings of an ambulance services, hospitals, fire departments and private emergency response services. And your duties is to assess the patient conditions, performing emergency procedures and transporting a patient to a medical facilities. And coming, you have various opportunities like advanced paramedic. So delivering an advanced medical care in an emergency situations. So the settings includes an ambulance services, emergency departments, air ambulances, and specialized rescue teams. Duties, you are supposed to administer medications, interpreting of ECG, EKG, electrocardiogram, and performing an advanced airway management and other life-saving procedures. And an emergency room technician, so you will be like assisting with the doctors and the nurses in the emergency room. So the settings will be in the hospitals and then urgent care centers. And the duties of being an emergency room technician will be like preparing the patients for examination, drawing of blood samples, performing an electrocardiogram, and assisting with the minor procedures. And an instructor or a trainer, this opportunity will you give as for EMTs to become a American Heart Association certified providers and an instructors. So these certified instructors, once you have become a certified providers for this basic life support and advanced cardiac life support, after being of 2 years of this provider course, there will be of a scope of becoming of a certified instructors who can train others within the institution or an externally. That trainers you can made like a, not only about your paramedical team, you can train the doctors, the MD people, MS peoples. You are like getting trained about the whole the basic life support things and an advanced cardiac life support things. And the settings, educational institutions, training centers, and then healthcare organizations. The duties like developing a training program, giving of awareness of the basic and advanced cardiac life support, like conducting classes and evaluating the student performance. Emergency management specialist. So this role is like planning and coordinating a disaster response and emergency preparedness towards the programs. And the settings is like a government agencies, hospitals, and a private corporations. And the duties of us like developing a emergency response plans, conducting a drills to get awareness that what all the possibilities might be happen, what might be the complications, to overthrow that complication, what all the preparedness you are supposed to do, and coordinating with various agencies during the disaster. Next is like a critical care transport specialist. So this role is like providing a medical care to a critically ill or injured patients during a transport, and settings like ambulances, air ambulances, all those things what we had discussed earlier. And the duties is like you are supposed to continuously monitor the patient. You can administer the medications and using of advanced medical equipment like intubating the patients and do some particularly life-saving procedures during a transport. And a healthcare administrator, where you will be like taking care of a managing of operating theaters and specifically the emergency department settings in the hospitals, clinics, or emergency care facilities. Duties will be like overseeing of staff, managing the budgets and the regulations of that, and improving the patient care services. Next, it's like a medical equipment sales and supporters. So what all the medical equipment we are like using in the emergency department, as being you will be knowing that what all the more things you will be laying, what will be the improvement you can do, or what kind of things will be like designing to make of more sophisticated care to the patients. Like that, it will be the role. A medical equipment companies, the setting will be. So you're like demonstrating the products, providing a technical support to this, and improving the equipments in the updated things. Next, research and development specialist. So the role will be like working on the development and improvement of the emergency medical procedures and technologies. And the settings is like a research institutions, medical device companies, and then universities. Here our duty will be like conducting a research, developing a new technologies, and publishing of findings what we have done through the medical journals. Next, flight paramedics. So providing an emergency medical care during of an air transport, where indeed of a very complicated thing. So the setting will be during a air ambulance services, and the duties will be like stabilizing the patients, administering the advanced medical care, and ensuring a patient safety during of a flights. And then the last, it's like a disaster response technician. So you will be like a role to respond to a natural or man-made disaster to provide an appropriate medical care. The settings is like a disaster response team, humanitarian organizations. The duties will be providing of immediate medical care, coordinating with a rescue team, and assisting in an evacuation efforts. And the additional considerations we can take like a further education. If you want to do a further education, what all the opportunities, what all these things we can be done. The graduates may also pursue an advanced degrees or certification such as Master in Emergency Management, Public Health Sectors, Medical Administration, or further specialization as a critical care paramedic. And the certification under licensure, many roles require specific certification under licensure such as EMT certification, paramedic license, or a specialized training in critical care or a disaster response. These all the things will be having an opportunities in the various courses if you want to go pursue for a further education. Next, coming to a higher studies opportunities, you can be like a critical care paramedic, flight paramedic, tactical paramedic, wilderness paramedic. You can undertake a postgraduate program like MSc Emergency Medical Technology. You may also get to do a research work in the field by opting for a doctoral program also. So this is about our emergency medical technology. Hope you all have understood what I have given. Is it clear up to now? If you
Yes,
have any
yes,
questions
yes.
related to EMTs, you can. So next, this is like related to a intensive care technology. So this is like B.Sc intensive care technology is like a well in demand course. Usually in an abroad, these course will like well defined. But recently in the 3 years back, as we have know that what is the importance of these things. So our Amrita University started this B.Sc intensive care technology also. The services of an intensive care technology are like high desired in very each and every hospital and a healthcare unit. Here in this course, we'll be learning all about the objectives of the intensive care given to the ICU to the patients. You learn monitoring the equipment regarding the data and providing these data to the physician, because there will be like a communication gap will be there. So you are being a barrier in between, and you as well as you are treating the patient and helping or supporting the patient, and you are supposed to give communication to the treating physician also, so that there will be of no gaps. You are like filling those gaps to improve the care and treatment for the patient. And you will be also learning or providing a first aid to the patients in the absence of a suitable medical aid. So the course structure is like a 4 year things, as usual, the same as like a B.Sc EMT. So the first year is like completely about a theoretical and a practical knowledge of the following subjects, that includes of anatomy, physiology, biochemistry, microbiology, introduction to a computer applications, quality assurance and accreditation, and English and soft skills. This includes in the first year. Coming to a second year, theory class and postings in the clinical area. So in this second year, you'll start coming to a department, emergency department. There you will be starting with the theory classes, and we'll be having a posting, will be giving of exposure starting towards the patient, and also with that pathology, pharmacology, applied basic sciences, and basics of an intensive care technology. And then third year, the theory class and the postings in the clinical area. So they were like a 3 subjects we'll be discussing you in detail, that intensive care technology clinical, and intensive care technology applied, intensive care technology in an advanced thing. And the fourth year, it is like an internship period, will be completely will be focusing in the clinical area of expertise. Next, what will be the career opportunities? So you can become an intensive care unit ICU technologist. Your role will be like assisting in the management and the care of a critically ill patients in the intensive care unit. And the what are the settings you will be getting through across is like a hospitals, specialized intensive care units, and a critical care facilities. And what will be the duties you will be like undergoing? It's like a monitoring of the vitals, and that is an important science you are supposed to know to rule out whether the patient is in a stable or an unstable condition, and maintaining a life support equipment, and assisting of a medical staff with the procedures. Next, you have an opportunity to become a critical care technologist, providing of a support in the management of the patients in a critical conditions. Settings includes of critical care units, emergency departments, and then trauma centers. And the duties managing of a patient data, operating complex medical equipment, and ensuring you are giving of a effective patient care. And a respiratory therapist also assisting the patients with the breathing difficulties and managing of ventilatory support. Your need is to be there. Settings of the hospitals, outpatient clinics, and the home care settings. The duties you are supposed to do, like performing of a respiratory treatments, managing of the ventilatory things, and educating the patients about respiratory health. And academic instructor or a trainer, opportunity for an ICTs to become AHS certified providers and instructors. So the certified instructors can train either in the others with the institution or externally, and teaching and training future healthcare professionals in an intensive care technology settings, either in a universities or a paramedical colleges and training centers. And the duties includes of developing of a curriculum related to the B.Sc intensive care technologies, conducting on a lectures and practical sessions, and mentoring of the students. And neonatal intensive care unit technologist also specializing in the care of an critically ill newborns. So we have like giving of postings to get awareness over there also in like a NICUs, all those things. So the settings, neonatal intensive care units in a hospital. The duties is like a monitoring and a supportive neonatal operation, specialized equipment, and assisting with the neonatal procedures. And medical equipment sales and support to specialists, as you can know about the what all the things like a ventilator things, equipments related, what are the you will be using in a critical care setting. So the medical equipment manufacturers and the suppliers will be in there, and the duties will be like presenting product futures. So what will be the products you can be used through, which can be improving the efforts on the management of the patients, and providing after sales support and training end users on the equipment. And then healthcare administrator. So the role is like a managing the administrative functions of healthcare facilities, particularly in the intensive care units, settings, hospitals, clinics, and specialized care units. And the duties is like overseeing of a daily operations, managing of the budgets of the ICU, ensuring that regular compliance is like going or not, and improving the patient's care and quality of things. Patient's care coordinator. So this is like a role coordinating the patient care plans, ensuring of the smooth transition between the different levels of the care. And the hospitals, rehabilitation centers, and the home care services or the settings will be come across. And the duties is like communicating with the patients and families. If you are like want to communicate with the what's happening to the patients, you can communicate directly in order to know what might be they were like deciding about the treatment plan, all those things, and you can coordinate and you can educate them related to the healthcare teams, and you can ensure the continuity of the care without any breakage. And emergency and trauma care specialist. So this is also another opportunity, providing an immediate and advanced care for trauma and emergency patients. So the setting, it's like an emergency department, trauma centers, and then field settings. And the duties is like a stabilizing of a patients, managing of emergency equipment, and coordinating with the emergency medical services teams. And the what are the additional considerations, or if you are like want to go for a further education, so what are the opportunities will be there. So the graduates must pursue advanced degrees or a certifications in related to their fields initially, such as a master's in a critical care, healthcare administration, or a respiratory therapist. So and the certification and the licensure is like very mandatory, as because many roles who are like requiring for the specific certification and the licenses, such as certification in the critical care technology, respiratory therapy, or an advanced life support. And also in our department, we have a simulation based training in emergency medicine department. So why that simulation is matters? So there is like a hands-on training is like essential for every EMT and ICT students. And initially in your first year, you will be like dealing with the practical subjects, it's like anatomy, physiology, biochemistry, and all the other subjects. But once you have come to a second year period, you will be like facing and treating the patients. You will be like looking over the patients. You are supposed to be note what might be the cause for the illness of the patients, and you need to treat it that patient. So if, for example, if you are like want to give any medications, you are supposed to, being a B.Sc, EMT and ICT, you are supposed to be known to insert an IV cannulation. So directly you can't go and keep an IV cannulation. Why? Because you will be like not well confident, and you might have been anxiety, stress. You will be not well confident. So that what we can do, so the Amrita has designed a whole one building of that central digital health will be there. That is like simulation training, where we people under emergency department will be training you in a hands-on training session until you feel a confidence in the initial first 1 to 2 months of period. Once you're getting confident and you are like aware of like going and practicing of the practical skills, now you will be like confident, go and you can treat the patient well without any doubt. And the bridges we can be gap between the theory and the real life emergency handling. And the dedicated simulation area at Amrita Hospital allow the students to practice the critical skills in a safe environment. And the key features of this simulation area is that this is like a high fidelity mannequins will be there. Means if you want to feel the pulsation of the patient, you can feel the pulsations. If you want to listen the heart sounds of the patient in a normal and an abnormal, you can feel the heart sounds. And if you want to auscultate for a lung sounds, you can auscultate for a lung sound through a simulation mannequin. Whatever you can do in like in the you going for a further third year or in that period, whatever you are treating the patients initially with the mannequin itself will be making you make comfort and to relieve the stress. Everything will be like using through the high fidelity mannequin and realistic emergency situations. So if you want, if you are like going and exposure directly over the real life emergency situation, you might have not felt that much toward the situation. Will be like creating a real life scenario. If suddenly a patient go for a cardiac arrest, suddenly the patient has been collapsed, so you'll be creating that environment to you to cope up to that situation and what might be doing in the further things. So training in a cardiac arrest, trauma, polytrauma, and choking management, and CPR, cardiopulmonary resuscitation, and an advanced life support training, enhancing the resuscitation skills with the hands-on practice that how to give off a compressions in a cardiac arrest patients, how to give a breaths in a, these all those things will be making you trained over the simulation area before going to treat the patient. And the teamwork and the critical decision making, as we are giving of a life real scenario, will be making you as a group of members to cope up your communication skill to share the information that what might be happen, what all the things you're supposed to do. So these all those things also will be like you people being a students, you can handle the emergency efficiently in a coordinated manner. And what are the benefits of this simulation training? So safe learning environment, which will be allowing the students to practice without risk to a real patient. This is like a very important thing. And a repetitive practice. So if you want to repeat it like once you have done an IV cannulation over the simulation, if it is like a patient, in spite of a simulation mannequin, if it is a patient, you are not supposed to do. Why? Because the patient will be like harm. So what you're supposed to do, we have created a high fidelity mannequin simulation thing where you can multiple times you can practice over that mannequin until you feel of confidence. Then you will be like feel more confident to go and treat the patient in a right way and right method and a right time. And immediate feedback, so it helps correct the mistakes in a real time for a better learning of the students and prepares for a real life cases, like ensuring the student that are like they were like ready to handle the emergencies. And the CDH, as I have mentioned, this is like a hub of advanced simulation things. So here the critical decision hall equipped with the advanced mannequin for a multi-departmental training, and then A and VR integration, the future expansion into a virtual reality based emergency simulation training will be there, and a specialized training for PG students, and then intense enhancing the real world emergency decision making. So this is how our simulation team will be like helping you to improve your skills until you feel confidence. Once you are like aware of all the skills, everything, you are like confident, then you can go and treat the patient in a adequate and appropriate manner. So what will be the higher studies? As we have mentioned, you can undertake a postgraduate program like a master's in intensive care technology or a critical care technology, and you may also get to do a research work in the field by opting for a doctoral program. And there is a like a scope you can go for in government sectors like after doing this public health administration, and also a master's of hospital administration and an MSc respiratory therapy. So these are like an opportunities or multiple opportunities where there if you want to pursue in a higher studies also. And this is like a we have planned like a disaster management conference. So Dr. Paul sir has came from a UK who has teached about the disaster preparedness, how to manage everything in a 2 days program. So all these program sessions also will be like conducting related to a trauma thing and then disaster management, where the students are like very happier to exposure these things, and we have created like a real life scenarios of all these things. And those who successfully complete the course will be have a very good opportunities in the all leading hospitals in the India and abroad. So who can be completing the real life scenarios and treating the patients very well, so that you will be like feels very satisfactorily. So this is how about the B.Sc Emergency Medical Technology and a B.Sc Intensive Care Technology. So do you have any questions and answers? Feel free to ask. I was there to answer you to your queries.
Thank you, Vishnupriya ma'am. That was really a non-stop explanation where we really understand how quick you will be in the emergency department and ICT. So, and how quick they have to be when they are handling really, really serious patients. So that was really a detailed explanation of all that you could say regarding the emergency medicine and ICT. So I'm very thankful to you about that. And for a few questions, if there are any doubts from the attendees who have joined us, you could ask, ma'am. Anyone there? If you have any questions, she would be answering it. Ma'am, before if we find out, we'll just check it out. But meanwhile, before we like come to a conclusion, we have Shankar from the admissions who will just explain to us about the admission process this year, and then we shall go on to the doubts.
Okay, ma'am.
Shankar, welcome.
Thank you, ma'am. Priya ma'am, can you stop the sharing, screen share?
Yeah, ma'am.
Hello, good evening, everyone. And in the second part, we will be discussing about the admission process to the EMT and ICT program 2025.
Shankar's video is not on.
Okay, ma'am. Ma'am, is it possible? Oh, yes. Okay, listed here are the 17 programs under B.Sc AHS in Kochi campus, and Emergency Medical Technology EMT and Intensive Care Technology ICT are two among them. And about the course, the duration of the course is coming total 4 years. That is 3 year plus 1 year compulsory internship. And the eligibility of the course will be age wise. You have to complete 17 years and a maximum of 23 years for each academic year. And the pass mark will be pass in +2 with the 60% aggregate mark in physics, chemistry, and biology. And the selection criteria will be marks scored in AWL plus interview. That is Amrita entrance exam plus interview. Both will be. And the fee structure for intensive care technology, the scholarship seat will fee will be coming 1.1 lakh. That is 1,10,000. And for the non-scholarship, it will be 1,40,000. And for the NRI category, it will be $3,000. And the other fees will be 41,000. And the admission processing charge will be 2,500. and the hostel mess fee will be 80,000. And for the emergency medical technology EMT, the scholarship tuition fee will be 90,000, and the non-scholarship will be 1 lakh. And NRI category, it will be 2,500 USD, and the other fee will be 41,000, admission processing charge, and hostel fee the same, 2,500 and 80,000 respectively. And here in NRI fee you have to pay in dollars, and the scholarship category that will be solely depend on the marks from the AWL and the interview. And coming to the selection process, we entrance examination dates will be May 17 and 18, and it will be conducted in 2 time slots from 10 AM to 12 PM and afternoon 2 PM to 4 PM. Either of this we can select, and after selecting that the time slot, you will be able to download the admit card from the portal. And the question paper pattern will be physics, chemistry, biology, and English will be there. And for physics, chemistry, and biology, 25 marks each will be there, each carrying 3 marks. And for English, 5 questions will be there. The same 3 marks for each one. So total 80 questions will be there, avoiding total of 240 marks. Each correct answer will be having 3 marks, and wrong answer will be having -1 mark. And the exam will be conducted in the Sundays that you are giving in the application portal, and it will be a CBT, that is computers based test. And the information about the syllabus about the AWL exam will be available in this portal, amrita.edu/admissions/AWL. And these are the website and portal for our admission process. Website is amrita.edu/admissions, and the portal is applyug.amrita.edu. If through either of this one, you can register for the program. And the registration closes on May 12. That's the last day for registering. Those who want to register, you have to apply before the date. And this will be the front screen of the application portal. Here you have to register, and you will be guided to the 5 steps inside the portal, where you have to give the profile, you have to give the preference of the courses, payment you have to do, after that academic information about the qualifying exam, and the documents upload you have to do. After having this one, after paying the application fee, you will receive a confirmation mail including the registration number and the credentials. You have to save that for the further reference. And for any details and for any support, you can contact any of these numbers, or you can mail us to ugadmissions@aims.amrita.edu. And this is a public notice from the Amrita Vishwavidyapitham campus. That is, we Amrita Vishwavidyapitham have not appointed any agents or third party for securing admission to any program. So you have to apply through any of our site, only through that one. We don't have any other third party or any other persons in the us. Okay, thank you.
Thank you, Shankar,
Okay.
for that explanation regarding the admission process. If you have any doubts regarding admission, you could please drop your doubts in the chat box. Madam, could I just ask you a couple of questions?
Yeah, ma'am.
Madam, like those students who, those candidates who really want to join emergency medical technology or intensive care technology, how should they mentally prepare themselves before they really get into these programs? Any preparation they have to mentally?
Mentally, they feel prepared, ma'am. Like, can you complete your question, ma'am?
Because some of them would be really frightened to get into such a situation where they see really serious injured or people like that. So how will they have to mentally prepare themselves?
So usually in the initial, for everyone, it will be like a very tension, or they will be like very frightened about that thing. So initially they should be like strong. They should be prepared, like they were like saving the life of the patient rather than getting into a fear, all those things. So if you have fear, there will be of nothing. So in a family, if anything like happen in your hand, there is like a talent to save a life of the patient. Like that, you should be like proud, and you are supposed to be step in our courses like an intensive or any other medical field, ma'am. So
Mm.
they should be like feel very proud that they were like saving a life of a patient who are in the need.
That's a very nice answer, ma'am, that you have given. So, candidates who have to really join should become mentally strong to face, because they know they are going to face such difficulties and they have to be mentally strong. Very nice, ma'am, about that answer. Another thing is, like, these candidates who are joining these courses, like, do they have these clinical postings from the first semester onwards, or is it theory in the
No,
beginning
ma'am.
and then?
So initially in the first year, they'll be like completely in the theoretical part, ma'am. So
Okay.
they will be like taking care of that anatomy, physiology, biochemistry, that like a basic subjects of a human body. So first they should be know what all the things will be happening in the human body, like anatomical thing and then physiological patterns. Once after finishing of getting passed over the first year, they then only they'll be coming to a second year, coming to a particular department, that is our emergency departments. So once after they were coming to a second year in the emergency department, initially we'll be like getting trained with the simulation to make them like comfort to rule out that real life scenarios, how it will be there. So we'll be like making comfort in a simulation based things, ma'am.
Okay, thank you, ma'am, regarding that. Madam, like, these candidates, are there more, do they have to more be used to the machines that will actually save the patients, or are there even other things apart from machines that will really be required?
So it's like depending upon the each patient thing, ma'am. If suddenly if a patient it's like a collapsed, so there is like no need to of a mission thing. So your hands, you are supposed to be getting trained, you are supposed to save a life. If the patient who is like not breathing, so then the mission need to be taken care, because for the long term you can't able to give the work through your hands, ma'am. It will be getting a fatigue. So it's depend upon the span of the patient. So how you are supposed to treat the patient, either through the hand-on effect or towards the mission learning. And mostly in case of an intensive and emergency care people, mostly the missions you will be taking care like an ECG and then like a ventilator, ma'am. That's like a most commonly you will be like treating, because it is like a life-threatening related to a airway or a breathing or circulation. And then the ECG taking of the things, all those things, ma'am. It's like all life-threatening things. You are like coming to the emergency medicine, you'll be taking care of like a ECG mission and then like a ultrasound mission and a ventilator, all those things, ma'am.
Okay, then now when they come, like, regarding why they should really choose Amrita, you have given a lot of
Yeah, ma'am.
reasons for that, but
Yeah.
regarding the job prospects for them, is it
Yeah, ma'am.
in more in India or more abroad?
It's like more in India, ma'am. So if you take me as a personal example, so I have completed my B.Sc anesthesia technology in Tirupati, and I have got so many opportunities in like in India, but I have chosen Amrita School of Medicine, particularly in that emergency medicine, like a scope of that like patients who were like coming with a different cases, and the treating we have like well equipped ventilators were there, doctors will be there who will be like training of most of the things. And here in this particularly why I'll be choosing like Amrita, usually if you are like going and seeing other hospitals or other colleges, so for this allied health sciences they were like not giving of adequate theoretical knowledge. They were like pushing you directly to the hospitals to care of the patients, or like they were letting one coordinator who will be taking. But here for these people they were like a particular time, like a classes which will be going in very detailed in a appropriate manners, and you are like giving of an adequate training with the simulation by creating a real life scenarios where you will be feel confident, then only will be like allowing you people to treat, so that they will be like more satisfactory that I have learned completely. Now I'll be like well enough to treat any of the patient who are like in need to treat, ma'am.
Okay, that's also nice to hear. Now, when
Yeah.
they, what are the different job opportunities they have? Like, not like, is it only the technical job that they have, like moving in the ambulance, and then something? Could you just explain, like, what are the different areas where they could?
Usually, if they were like want to stop over that like B.Sc itself, there are like various like air paramedic or like flight paramedics, and they can take care of that in ICU. If like we are talking about an intensive care technology, he'll be like an intensive care technician, and he can take care of the intensive care coordinator depending upon the expertise, and he can take care of that equipment related things. As we are using like an ICU, like ventilators, all those things, so they will be taking care of an sales side, equipment related side, and flight paramedic, or and then disaster management thing. So here in every hospital there will be like a disaster management team will be there. In that they can be one of the team, and an ICU in charge. All these opportunities will be there, ma'am, for them. If they were like stopping with a B.Sc, if they were like pursuing like a MSc in intensive care technology for further education, then they can completely go towards like a teaching field. And one along with that, in B.Sc, if they were like becoming as a AHA certified provider, after 2 years of like continuously educating the people regarding of like a CPR, like cardiopulmonary resuscitation, once after 2 years they can become like a instructors, and they can start a program under the college or like an institution, and they can train multiple people who is like either a paramedical professional or like an MBBS or an MD, all those things, ma'am. So there are like various opportunities as I have mentioned, ma'am.
Okay, thank you so much, Vishnupriya ma'am. I don't see any more doubts on the in the chat box. So I think we should be winding this webinar now. So anyway, before we come to the conclusion of this session, I would extend my sincere gratitude to you, to Prasad, Doctor, who had just come in the beginning and helped us or explained to us the initial techniques or the reasons why they should really join emergency medical or intensive care technology courses here in Amrita. And also I am very grateful to both of you for spending your valuable time with us throughout this session, this long session where you had individually spoken about both these programs and taken such a lot of energy of yours to explain to us about this. So I hope all the attendees who have joined the session have got enough and more information regarding emergency medical technology and intensive care technology. And we hope to see you soon in the Amrita campus. Thank you once again, Vishnupriya madam.
Thank you, ma'am. Thanks for giving this wonderful opportunity, ma'am.
Thanks to all. So we conclude this webinar for today.